Nigeria on Tuesday received her first batch of coronavirus vaccines under the COVAX scheme. The shipment of 3.92 million vaccine doses made Nigeria the third country in the world to receive the virus vaccine through the World Health Organization's COVAX scheme. The vaccination rollout started a few days later on Friday with Dr. Cyprian Ngong, a medical doctor at the National Hospital in Abuja, receiving the first jab of the AstraZeneca Oxford COVID-19 vaccine, alongside other frontline healthcare workers.
Well, President Muhammadu Buhari and Vice President Professor Yemi Osibanjo received their vaccination on live television yesterday. Well, joining us now to speak on this is retired Major General Obashina Ogunbiyi. Welcome to the morning show, sir. Thank you for joining us on the program today.
Good morning. Thank you so very much.
Right. Well, as you heard in my introduction, the president and the vice president both took their jab yesterday. And, it's the AstraZeneca vaccine. And, a lot of people have been talking about this vaccine. And there's been a lot of controversies surrounding the vaccine. There's some research that proves that it's about 62 or 60% effective, while others say it is very effective in treating the coronavirus. Now, I'd love for you to share with us what your thoughts are with this vaccine and the rollout program that the federal government have implemented.
Thank you so very much for having me on your program this morning. It's interesting that Nigeria is one of the first 5 countries, I dare say, in Africa that has received this vaccine and has rolled it out for the benefit of the citizens. The coronavirus vaccine is actually one of the ways of curtailing or containing the COVID-19 challenge that has been on throughout the whole world, which has made it a pandemic. And the whole idea behind the vaccine rollout, among other things, is the fact that in preventive health matters, such as what we have now, vaccine usage diminishes the impact of the COVID-19 challenge, and it also is able to reduce the death among the citizens. And it's irrespective of how the vaccines have come to be, because some people say, no, developing a vaccine takes 5 years, takes 10 years, or thereabouts. That's one of the challenges we have with this. However, we should know that these are digital times, and some processes have been fast-tracked along the line in the manufacture, in the conceptualization, manufacture of these vaccines. And to me, I think the vaccines are coming at the right time, considering the amount of mortality or fatalities we've been having, even in our country, especially with the second wave of COVID-19, which we had recently.
I mean, we are all pretty confident about the benefits of taking this vaccine, the purpose of it, but I still think at this point there is a little reluctance for some people to take it. I know that at the welcoming ceremony of the vaccines rolling in, you did have Femi Gbajabiamila say that, we have to dispel any type of myths when it comes to this vaccine and understand a vaccine is a vaccine is a vaccine. That being said, I can imagine that as it stands, when we look at objective facts, none of us really know what the long-term ramifications of this vaccine could be. And as a result, there could be some reluctance for people to even take the vaccine should they get the opportunity to have it offered to them. What do you say to anybody who has any type of reluctance at this point?
Yes, like I mentioned earlier on, it's better to have something and be sure that what you have heard, it's in line with the management of the disease system, other than not have it and develop the disease itself. It's a matter of balance between you having it and be sure that you've had it, knowing fully well that being a vaccine, it's going to reduce and reduce death and reduce even the severity of the disease system. So, it's a balance between the cost-benefit ratio as it is. So to me, I want to encourage as many people as possible to take the vaccine. Up until date, some countries in the Western world that have taken about more than 40 million doses of the various vaccines have been given out. And apart from going through the records and going through data published so far, very few cases of side effects, major side effects, in over 40 million. So I think it's something worthwhile.
Well, it is evident that we may not be seeing a sizable control of the pandemic in Nigeria because the federal government is saying that, the rollout program will be in phases and it will last for about 2 years, correct?
Yeah.
Now, in your opinion, your assessment, what will be a better form for this rollout strategy? I know that the strategy that they have put in place looks quite effective, but I don't know if 2 years seems like a stretch, given that some other countries are saying that they will have herd immunity by summer, like the United States.
Well, the first thing I say in this respect is that for Nigeria, you will agree with me too that the effects of the coronavirus on the citizenry is not compared as to what we're having or whatever in the United States, in China. You understand me? And that has to be one of the factors that may have been put in place by the PTF, for instance, in coming up with this 2-year strategy, among other things. Knowing fully well that, if you remember, in the early days last year of the pandemic, usually those affected were of the age range of 60 and above, 70, 80s. That is in China, in the United States, in Europe, and so on and so forth. But with us, we did not have that effect as well. And later on, we found out that, especially with the second wave that we had, it was the middle age range that were mostly affected. In actual fact, as we have seen, COVID-19 is irrespective of no age at all whatsoever. And with me, I think what the government had done in phases, to give the vaccine in phases for those who are likely to benefit from it mostly. Those are the frontline workers.
Right.
It's ideal that they be given first. And also, they graduated it before with those with comorbidities, and then to the young people 18 to 30 year olds, which are going to be the last set. I think it's okay.
So you think it's a good time in the 2 years?
I think so.
Okay.
I think so. And then, of course, the economic factor too must have been put in place as well, right? And like I said, those who are mostly affected are those in the front line and those who are vulnerable to the disease.
When we talk about lasting lessons when it comes to this pandemic and vaccines, do you think that this pandemic has exposed, using Nigeria as an example, a big gap in research and development? Because, I don't think it's too much of a stretch for us to say that Nigeria should have the capability to develop its own vaccines, or at the very least be able to safeguard its own populations without having to rely on, for lack of a better term, charitable donations from the World Health Organization. So looking ahead to the future, looking at the fact that South Africa is in some type of progress when it comes to rolling out its own vaccines with the Johnson & Johnsons, do you think Nigeria will be able to move in that space? And do you think that when it comes to monies being given to medical sectors in this country, now there is a bit more focus on the medical industry in this country to make sure that should something like this ever happen again, heaven forbid, we'd be adequately prepared?
Oh, yes. Thank you very much for that question. And it's interesting to note that as we speak, there is a team of researchers from Nigeria that have been identified by the World Health Organization with respect to developing a Nigerian-based vaccine. I think the principal investigator is at the Cornerstone University, somewhere in Ede or wherever, all right? And what this tells me, among other things, is that our researchers, medical scientists, have not just sat down and be folding their arms, so to say. But apart from that, one of the lessons that we have learned in this response, for instance, at least talking of Lagos State, because Lagos is the epicenter of the COVID-19, In 2014, 2015, we had the Ebola crisis, still Lagos being the epicenter. And the Lagos State government had done so much since that Ebola crisis, a time of Ebola crisis, that the infrastructure that they had in place since that time were just put in place for this particular COVID-19. The Life Center Gbagada, it's a public-private partnership initiative of the Lagos State government. Like you rightly said, the Lagos State government has provided the infrastructure, and the counterpart company, we have provided specialists for this, skilled specialists for treatment of this COVID-19 pandemic, as it were. At Life Center Bagada, we do testing on site and PCR testing on site, and within 24 hours, you get your results. It's one of the Lagos State government accredited laboratories. And apart from that, we also do treatment. We offer treatment to those who want affordable treatment of COVID-19, all the phases of COVID-19, in a very good environment. And we offer, like I said, we offer at affordable rates treatment of these facilities.
Very nice. So we can, look forward to going there.
Yes, it's actually meant for high-ups like you.
Oh. High-ups, what are you charging? Well, congratulations with that as well, and I understand that you guys are not, you're just doing testing and you're not doing these vaccination programs.
No.
But I wanted you to educate our audience in terms of the vaccination programs that have been put in place. The health agency has said that, we're not going to be seeing, at the slowdown of the spread of the COVID, given all of these vaccination programs that we're seeing by the end of the year. I mean, what are your expectations with the vaccine that is in place right now with the community?
Yes, thank you very much, OJ, for that. It's interesting because the Oxford AstraZeneca vaccine, which is what we have presently in Nigeria, presently is data is suggestive that it can have an efficacy of between 67 to 92% against the COVID-19, averagely 70-75%. And as I mentioned earlier on, it's better to have something than not have anything at all. And it's expected that by the time you give a certain percentage of the populace this vaccine, you are aiming at having what we term a herd immunity of the populace, all right? And when this is achieved, it's as well to say the pandemic, the disease has been contained within that environment in public health circles.
Right. I guess in addition to that, we could also widen our conversation to talk about preventative care. You're obviously in support of the vaccine. You definitely think that people should get it if they have the opportunity to. But then, as it stands, we know that there are a whole lot of people in this country, and with the COVAX rollouts, that's obviously not going to cover everybody at this immediate point. So when you talk about preventative care, what do you mean by that?
Oh yes. Before I even go to that, I need to mention here and sound a note of warning that COVID-19 still has no cure. And what that tells me, the vaccine usage is not curing COVID-19. It's just building up immunity against it.
Right.
And what that means again is that there will be parts of the populace that will still have COVID-19. And that leads me to the preventive aspect of it. And which means that despite taking the vaccine or not taking it at all, the best way is to go and still be doing the guidelines and protocols which have been told us. That is, wash your hands as much as possible, social distancing. I mean, you can see us here.
You're trying.
Yes, absolutely. And use of hand sanitizers. I carry my hand sanitizer, one portable and hand sanitizer. You think it's you'll think it's a perfume, but it's a hand sanitizer. You know, I've used it thrice this day.
Yes.
You know, since I got here, and of course, the gold standard is that of usage of face masks, not only to protect yourself, but also to protect the other, your neighbor as well. And I want to commit unto every Nigerian that we should still be using this guidelines, and you should still be using the guidelines and protocols as dictated so far, irrespective of whether you get the vaccine or you don't get the vaccine, because the disease still has no cure till date.
So what happens is, even if you're vaccinated, you can, still have it, but it will not kill you because you have the immunity. But then you can also transfer it to others.
Oh, absolutely.
And that's one of the biggest issues. Let's talk more on this rollout program. I know that the federal government has implemented, the registration of this electronic management of immunization data, where Nigerians can go and register for getting
you can actually do it either on site there or using your devices.
Right. But a lot of people have said that, the older generation, which are among the people that are in the first phase, may be disenfranchised by, this data process. What are your thoughts on that, and how can that be addressed?
Well, it's an issue which has been raised is the fact that these vaccines, there are still some doubts as to the efficacy in the older age groups. The Canadian Committee on the immunization vaccines raised issues on this. Also, there's another study in South Africa that raised issue on this. And to be on the safe side, I think the government had done well to strategize on the priority areas, that will benefit mostly from the pandemic, from the vaccine utilization. So to me, at the end of the day, nobody will be disenfranchised. The government has told us categorically that they are going to get so much of this vaccine. This is just the first batch.
Right.
All right? And we know children below the age 5 years and below, they will not be vaccinated, of course. And we have been told as well that those aged 18 years and below may not be vaccinated as well in the first phase, second phase, or thereabout. So I don't think at the end of the day, most people may not be disenfranchised from this vaccination. The challenge is for us as individuals to actually be convinced that we need to be vaccinated. And as we saw yesterday, the Mr. President and the Vice President, they were openly vaccinated. That's telling us that do as I do.
Exactly.
That's the message they have passed to us.
Exactly.
So.
All right.
Right.
Well, thank you very much. It looks like we've come to the end of our time here. We've really enjoyed it. I know it feels as though it's gone quite short, despite the long time you spent with us this morning.
It's all right.
But thank you very much for your time.
Yeah.
That was, of course, Dr. Obashina Ogunbiyi. Thank you very much for joining us.
Thank you.
Thoroughly enjoyed
Don't forget Life Center Bagada.
Yes.
We are available for testing and treatment of the COVID-19.
And isolation, I believe.
Isolation, yeah.
Indeed.
Yes.
Well, good
Indeed.
job.
Treatment.
Thank you.
Thank you
very much.